Have you ever heard of someone who seemed perfectly healthy, only to suddenly suffer a heart attack or stroke? It's shocking, and it leaves families asking, how did this happen? Weren't there any warning signs? The truth is, artery blockages rarely happen overnight. They build up slowly, often over years, and the body does send out warning signals, just not always the ones you'd expect. These are the silent signs of artery blockages you simply can't afford to ignore, especially if you're over 40, have a family history of heart disease, or live with high blood pressure, diabetes, or high cholesterol. Today, we're going to uncover the most overlooked symptoms of artery blockages, explain why they happen, and show you what you can do right now to protect your heart and your life. By the end of this video, you'll know how to listen to your body's subtle messages and take action before it's too late. Let's start with a simple fact. Your arteries are the highways that deliver oxygen and nutrients to every part of your body. When they're clear and flexible, blood flows easily, and your organs work at their best. But over time, cholesterol, fat, and other substances can build up on the artery walls, forming plaque. This narrows the arteries, restricts blood flow, and increases the risk of heart attack, stroke, and even sudden death. The scariest part? Most people don't feel any pain or discomfort until the blockage is severe. So what are the silent signs of artery blockages you can't afford to ignore? Let's break them down, one by one. 1. Unusual fatigue. Do you feel tired all the time, even after a good night's sleep? Chronic, unexplained fatigue can be an early sign that your heart isn't getting enough oxygen-rich blood due to narrowed arteries. If simple activities like walking to the mailbox or climbing stairs leave you exhausted, don't brush it off as just aging. Your heart may be working overtime to push blood through partially blocked arteries. 2. Shortness of breath. If you find yourself getting winded easily or struggling to catch your breath during mild activity, it could mean your heart is working harder to pump blood through blocked arteries. This symptom is often mistaken for being out of shape, but it can be a red flag for heart disease. Sometimes shortness of breath can even occur while you're resting or lying down. 3. Chest discomfort or pressure. Not all heart problems cause sharp pain. Sometimes artery blockages cause a feeling of pressure, tightness, or heaviness in the chest. This discomfort may come and go and is often triggered by physical activity or stress. It might feel like indigestion or heartburn, but if it's new or unusual for you, it's time to pay attention. 4. Pain in the neck, jaw, back, or arms. Blocked arteries don't always cause pain in the chest. Sometimes the discomfort radiates to the neck, jaw, shoulders, back, or even down the arms, especially the left arm. This is more common in women and can be easily overlooked. If you notice pain or pressure in these areas, especially with exertion, don't ignore it. 5. Dizziness or lightheadedness. If you feel dizzy, faint, or unsteady, especially when standing up quickly, it could be a sign that your brain isn't getting enough blood due to narrowed arteries. Don't ignore frequent episodes of dizziness, especially if they're new or unexplained. 6. Cold hands and feet. Poor circulation from blocked arteries can make your extremities feel unusually cold or numb. If your hands and feet are often cold, even in warm weather, it could be a sign that blood isn't flowing properly. Sometimes you may also notice tingling or a pins and needles sensation. 7. Swelling in the legs, ankles, or feet. When blood flow is restricted, fluid can build up in your lower body, causing swelling. This is called edema and can be a sign of heart or vascular problems. If you notice your shoes feeling tight or see indentations in your skin after removing socks, pay attention. 8. Erectile dysfunction. For men, difficulty achieving or maintaining an erection can be an early warning sign of artery blockages. The same process that narrows arteries in the heart can affect blood flow elsewhere in the body. Don't be embarrassed to talk to your doctor about this symptom. It could save your life. 9. Slow healing wounds. If you notice that cuts or sores on your legs and feet take a long time to heal, it could be due to poor circulation from blocked arteries. This is especially important for people with diabetes, but anyone can be affected. Slow healing means your tissues aren't getting enough oxygen and nutrients. 10. Irregular heartbeat. A fluttering, racing, or irregular heartbeat can be a sign that your heart is struggling to pump blood through narrowed arteries. If you notice palpitations, especially with other symptoms, seek medical advice. Sometimes an irregular heartbeat can be the first sign of a serious problem. 11. Nocturnal symptoms. Some people with artery blockages notice symptoms at night, such as waking up short of breath, needing to prop themselves up with pillows, or experiencing chest discomfort while lying down. These signs should never be ignored. 12. Jaw or tooth pain. Believe it or not, pain in the jaw or teeth, especially on the left side, can be a sign of heart problems. If you have dental pain that doesn't seem to have a dental cause, consider your heart as a possible source. Now, you might be thinking, these symptoms sound common and sometimes harmless. That's exactly why artery blockages are so dangerous. The signs are often subtle, easy to ignore, or mistaken for other problems. But your body is always sending signals. The key is to listen and act before it's too late. Now that you know the silent signs of artery blockages, let's talk about what you can do to keep your arteries clear and your heart healthy. 1. Eat a heart-healthy diet. Focus on whole foods, fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil, nuts, and fatty fish. These foods are rich in fiber, antioxidants, and nutrients that help lower cholesterol and reduce inflammation. Cut back on processed foods, sugary drinks, red meat, and foods high in saturated and trans fats. Try to fill half your plate with vegetables at every meal and choose whole grains over white bread or rice. 2. Get moving. Regular physical activity helps keep your arteries flexible and clear. Aim for at least 30 minutes of moderate exercise most days of the week. Even brisk walking, swimming, or cycling can make a big difference. If you're just starting out, begin with 10-minute walks after meals and gradually increase your activity. 3. Manage your weight. Carrying extra weight, especially around your belly, increases your risk of artery blockages. Losing even a small amount of weight can improve your heart health. Focus on slow, steady weight loss by combining healthy eating and regular exercise. 4. Control blood pressure and cholesterol. High blood pressure and high cholesterol are major risk factors for artery blockages. Get regular checkups, take medications as prescribed, and follow your doctor's advice to keep these numbers in check. Monitor your blood pressure at home if possible, and ask your doctor about your cholesterol levels. 5. Quit smoking. Smoking damages your arteries and speeds up plaque buildup. If you smoke, seek help to quit. Your heart will thank you. Even if you've smoked for years, quitting now can dramatically reduce your risk of heart attack and stroke. 6. Reduce stress. Chronic stress can raise blood pressure and harm your arteries. Practice relaxation techniques like deep breathing, meditation, or gentle yoga. Make time for hobbies, connect with loved ones, and don't be afraid to ask for help if you're feeling overwhelmed. 7. Get regular checkups. Don't wait for symptoms to get worse. Regular health screenings can catch problems early when they're easiest to treat. Ask your doctor about tests for cholesterol, blood pressure, blood sugar, and if you're at high risk, imaging tests to check for blockages. 8. Listen to your body. Never ignore new or unusual symptoms, even if they seem minor. If you experience chest pain, severe shortness of breath, sudden weakness, or fainting, seek medical help immediately. Trust your instincts. If something feels wrong, get it checked out. 9. Stay informed and proactive. Knowledge is power. The more you know about your heart and arteries, the better choices you can make every day. Read, ask questions, and stay up to date on the latest heart health recommendations. 10. Build healthy habits for life. Remember, protecting your arteries isn't about a quick fix. It's about making small, consistent changes that add up over time. Every healthy meal, every walk, every good night's sleep is an investment in your future. If you found this information helpful, share your thoughts or questions in the comments. What changes are you ready to make for your heart health? Your story could inspire someone else to take action. And if you want more tips on heart health and living well at any age, don't forget to subscribe and turn on notifications.